Alright, hello YouTube. My name is Anand Patel. I've always kind of wanted to start a YouTube channel, so this was kind of just an excuse to get started, but also has like an actual purpose. Sorry my camera quality is kind of crappy and the lighting ain't that good. Tried doing it on my laptop, but for some reason it's just absolutely terrible on my laptop, so I'm on my phone here. But the reason I'm making this video is, well, as you can kind of tell, I in a sling here, shoulder surgery. So doing a lot of research, I kind of found there wasn't a lot of information on this specific surgery that I had, which is called the Latarjet procedure. I'll get into like the details of like the official name later on, just for anybody who in the future, if they have like the same exact kind of procedure, down to the bone. But even if not, similar I'm sure is good enough too. I've never done this before, never filmed a video or anything, but I just did a lot of research, found out there wasn't really that much on like people's testimonials about it. There's a lot of research and videos and information on medical knowledge for students or other doctors, and showing animations of the surgery or a lot of medical knowledge about it, but not necessarily like people's experiences getting it, or just shoulder surgeries in general, which I thought was kind of strange, just because I thought the first place people would go to when they have a major operation is like the internet, specifically YouTube, because you can like see visually what's going on. But just give you a little background. I'm 23 years old. I first my shoulder popped out when I was like 17, and I mean there's a lot of reasons why it's gotten like this bad, and I might get into that in like a different video, but just to give a brief rundown, that happened all the way in 2018. It's 2024 now, for reference, if you see this in the future. First time it happened in 2018, April. I was just climbing, and basically a friend wanted to race on this inflatable, and like I said, I was climbing, pulled up, just felt it kind of pop out, and then I was at the top of it, so I put my arm down, and like it went back in. And so since then, basically doing any sort of motion, throwing, catching, anything, it would just keep on happening, for like that year, the next year after that, graduated high school, went to boot camp, happened a couple times there. 2020, I got surgery. So for those of you who've had one in the past, or like aware of like shoulder instability issues, popping out of the socket, going back in, I had an arthroscopic Bankart repair. So if you're like me and you've basically seen every single video or researched everything about shoulder surgeries, that someone who isn't a doctor, if you've already gone through all that, you probably know like a slap tear. So I think it's superior like labrum, or like anterior to posterior. So basically the top half of your labrum is called a slap tear. So a lot of overhand throwing athletes, they get that. And then what is the bottom half, they usually refer to like a Bankart lesion. So got the MRI, they thought it was a slap tear. There was actually a Bankart tear. Got it repaired in 2020. Said I was good to go. Never recovered super well. They tell you like 6-9 months you'll be good to go, you can do everything. Didn't work out for me, but anyway, 2020, got the surgery. 2021, recovering. Didn't work out. 2022, retore. And then since then, constantly just, I could never do anything normal. So to say that being recovered and healthy and like a normal young person, this is like long overdue. But I just kind of want to make this video for like the people who've are anticipating surgery, maybe they're going through it right now, but they just kind of want to see, you know, what someone's experience like. So for me, I've had a lot of episodes, and it's like you're probably not going to meet someone who has worse than I do. And like I said, I'll give more in-depth background probably in a different video. But just to give you a rundown, like where I am right now. So ideally, I would have made this video a week ago, like the day I got surgery. So September 25th, 2024 is the day I got surgery. Now it's like a week later. So this is like week one. So like week one, part one, however you want to call it. So, you know, I had the surgery, of course, and I've done like kind of like the very initial things of like you take a bunch of pain meds. I had the bandages on for a week, and then now I just got them off. So I just kind of want to be like showing every week what it kind of looks like on the outside, you know, movement, and just kind of give a rundown of like what I can do. So this past week, you know, I've been in a sling, and I'll take the shirt off in a sec so you can see. Been in a sling, right? Like after you have surgery, and what they do, if you haven't already researched another video, and I might like, once I learn how to tag stuff and all that stuff, maybe I'll like link those in the comments or something. But a Latarjet procedure is basically a procedure in which they take a piece of your coracoid process, which is a bone that's right above the shoulder joint, and they cut that bone. And then there's going to be a little piece of bone there, right? And then I think what they do is they cut it again to have like exposed like bone marrow, or like I guess like live tissue or something like that, right? You know, basically just the inside of the bone, right? And so my shoulder, and again, I've already had a surgery, so this is like a second one, because the first one didn't go well. But my shoulders popped out so many times. Like I lost track, but it's probably like over 15, over 20. And so the socket, right? It's a ball and socket joint. Here, I'll use a water bottle because I can't really use my arm. But it's like a ball and socket joint, right? So imagine if this is your humerus and this is the glenoid. Well, after it happens so many times, like the piece of the glenoid is going to break off. So the coracoid process, they cut that, they cut it again, and then they use that little piece, and they fill in the missing portion, okay? And then also, depending on just your injury, your labrum might need to be repaired and cleaned up. Like for me, I probably had scar tissue and all that stuff. But even if this is like your very first surgery, typically that's what they're gonna do. They're gonna make an incision here, cut the bone, take that bone, place it in that missing portion, and then put in like 1 or 2 screws. So I have like 2 screws. Sorry, my phone was just low battery. So that's the surgery, and in terms of like the timeline, it's supposed to be 6 to 9 months. So just kind of like assume 9 months, which to a lot of you might seem like, oh my God, it's such a long time. But for someone who's been through like 6 years of shoulder problems, you know, you'll kind of realize how short 1 year of your life is across your entire life, especially if you're on the younger side, you know, and you're not like 50, 60 or whatever, like people having this later in life, like in old age, which most of the people, you know, when I go to the clinic, they're like that. But anyway, that's the surgery, and yeah, 6 to 9 month recovery, but it's more like a full year. Like if you're thinking about this right now and you're like kind of trying to prepare yourself, just prepare yourself like it's gonna be a year. Like don't even think of like the 6 months and like trying to get back into it like as soon as possible. Like whether you're an athlete, whether you're in high school, college, doing sports, whatever, like, and I know it sucks, like it really sucks, but you'd rather spend an entire year and be very, very thorough and persistent on PT and recovery. And this is speaking from personal experience of it didn't even work out, and I did years of physical therapy, but you'd rather do that than kind of half-ass it do it for like 3-4 months and then start doing things earlier than you really should, and then deal with further issues potentially for the rest of your life. Might be a couple months, couple years, but if you don't do everything properly the first time around, and like I would actually say to do more, if they give you 3 months PT and like then you're done, like I'd be like, hey, can I do the fourth, fifth, sixth, like just to nip it in the bud, and then you're good, and it's not like a recurring problem. I mean, there'll always be a little bit of ongoing maintenance, but you want to like make it as minimal as possible. But anyway, that's the surgery. That's what the intended recovery is going to be in terms of the timeline. And then now I guess I can kind of show, like, it's pretty gnarly. I mean, it's been a week, like I said, so if you don't like scars and stuff, don't get too scared. But I mean, that's how big my scar is. It is pretty big. Like, I think the low quality on the camera can kind of hide how really kind of disgusting it looks, but I don't necessarily do this to scare anybody. It's more so that people, hopefully they see this now, and then they see a video like 3 months from now, and then they see like how much further you can go in that period of time, and just to give you some sort of predictability, because I know for me that's the scariest thing. It's like the uncertainty and not knowing what's going on and what's going to happen. But this is probably standard. I haven't seen obviously other people with the surgery. I don't know anyone who's gotten this or anything, but it goes kind of down into my underarm, so you can't see that part as much, and I can't lift it too much, but it's pretty standard. If your surgeon's doing more than this, I mean, it's probably unnecessarily, unfortunately, but I have this, and then also there's a little hole in the back because I had a failed surgery. My situation's really shitty, and so they had to like clean up stuff and things like that. But that one's really small. You can't see it because I got a new dressing on it, but this is the main thing. So this is what it looks like. I don't know if you can quite see. It is pretty discolored and stuff, but I think the bad lighting and camera quality is kind of hiding that. But if you do have bruising and stuff, and you haven't already asked your doctor and stuff, like, it's fine. Don't worry about it. It looks weird, but it definitely looks a lot worse than it feels. So depending on your surgeon, you'll get anesthesia. So general, meaning you're just knocked out, like your entire body, you're just gonna knock out. You're not gonna remember anything, whatever. Or you get local anesthesia. So I didn't get local anesthesia. I got general anesthesia. My first surgery, I got a nerve block. So depending on your surgery, you might get nerve block, general anesthesia, or local anesthesia, or like 2 out of the 3 or something. But brief summary: nerve block, first surgery, I didn't really feel anything. First day didn't hurt at all. Second, third day hurt like hell because the nerve block is wearing away, and then you take your pain meds. Anesthesia, it hurt a lot when I woke up. I think I got woken up a little too early, but then over time it gets better. So it's kind of like the difference, at least in my experience. And then also with anesthesia, the big drawback, in my opinion, was like you're just so nauseous. Like I was nauseous the entire day. Like last Wednesday was absolutely terrible. But it does get better. By the next day, it should be all out of your system. So this is what it looks like. And then now I'm just gonna kind of like try to show how much I can move, which is basically really nothing. So in the beginning, they might have you do a little bit of exercises, like just kind of like this type of thing. Depending on your surgeon, I mean, I was told, and again, this is 1 week, okay? I was in the sling, all the time except for showering, which you can't do until the next day, or maybe 2 days, depending on if you like stay overnight, which most of the time you just get there in the morning, leave in the afternoon, or get there in the afternoon, leave in the evening. And then you'll see how this handy dandy little ball kind of looks like. you know, you can play fetch with the dog or something, but no, you're just supposed to like squeeze that. And then like they'll have you do the whole like kind of rubbing your thighs thing, which those three, they might have you do that, and that's pretty much about it. And then in terms of movement, I mean, this is like all I can do. Like, I can like go a little bit out. I mean, yes, I can move this, and I can pretty much do this day one, but I wasn't taking my arm out of the sling because I'm not really supposed to. But I can just tell with being in the sling. But yeah, I can't really move. I mean, again, this is week 1, and I don't want to stress it too much because this is my 6th year having all this stuff, so obviously trying my best to do everything properly, and hopefully this one's the one. But yeah, I mean, that's pretty much it. Like, that's the surgery. This is what yours is probably gonna look like in the beginning. If you get this the first time, you're probably gonna have nothing on the back, right? That's just because I have a really bad case, and I had a previous surgery in which they needed to clean up, I think, scar tissue and like frayed cartilage from my labrum being torn on the first surgery. I could go on and on and on about shoulders because like I've researched so much and I've had so many issues, so I probably know way too much. I feel I'm not a shoulder expert, but like I feel like I know way too much, for someone who's not a doctor or nurse or anything. But yeah, that's the surgery. This is what it looks like week 1. I just showed you how much I can move, and kind of my plan on here out, like I said earlier, is just kind of showing how the scar is healing up, what it looks like, the range of motion I can do, and then give you an idea of like day-to-day activities. So like right now, after 1 week, and again, results might vary depending on, or instructions may vary depending on surgeon, but I just want to kind of make it as detailed as possible. I now, after 1 week, can be out of the sling when I'm sitting, but when I'm standing walking, still need to wear it, and not really supposed to be driving. This clinic said that they don't really recommend it they don't have like a set, like, oh, after 2 weeks, like you could go drive, right? Like, you're still in the sling, and they just don't want to take liability. Some people might tell you that after a few days you can drive, but that's just kind of up to the surgeon or the clinic, I guess. Typically, I would say you probably want to avoid driving. Like, you have a roommate, parents, siblings, friends, somebody who's taking care of you during this time or helping you, or like, get things delivered until you're like out of the sling, because obviously one-handed driving, it can be done, right? Like, I mean, I do it before I even had surgery and all this stuff, but it's not so much that, it's so much like you don't want to get in an accident and like literally do this all over again. So I don't plan on driving that much, but if I do, I'm gonna like limit as much as possible until like probably like a few weeks from now. But yeah, wear the sling when you're sleeping, walking, or standing. Sleeping's a whole nother thing. They'll kind of tell you sleep in a recliner, or you can sleep in a bed, but you just need to put a lot of pillows behind your back because you're gonna be sleeping on your side and like have your affected arm or operated arm, the side that's up, obviously, and you're not sleeping on that side. And then yeah, I can take it off for showering, of course, but you do kind of want to leave your arm like this. And when you first get out of surgery, you can have bandages, so you have to like saran wrap it or do something to keep it not wet. Today is the first day where they took it off, and I asked them, is this fine, like water going through it? And it is. They just told me to use this HibaCleanse like cleanser. So basically it's supposed to like be a disinfectant or something like that, and then like clean it with alcohol. So depending on your surgeon, They probably won't put a dressing because they told me you can't really do that because of the positioning of the like this the incision and everything, because if you try to put that there, it's just going to come out. But yeah, wear the sling except for showering and sitting after 1 week. Probably depends on your surgeon. I think mine's more kind of aggressive on like getting moving as soon as possible. And then basically for 2 more weeks, I should be in the sling. Just to give you reference, my first surgery, which was less invasive, the arthroscopic Bankart repair, which if you've heard of it or had it, it's going to be like kind of 4 holes. It's not going to be this one big line, one big cut. It's just like 4 kind of little holes. They put the cameras, and somehow they do everything through cameras and like these little holes. I was actually in the sling for 4 weeks, and when I did research for that surgery, it said 4 to 6 weeks. So I was actually on the quicker end. So don't be surprised if you're in a sling for 4 to 6 weeks for this Latarjet procedure. I think my surgeon / clinic, their protocol is just more on the aggressive side. And of course, I've already had surgery, so I'm kind of more in tune with limits and sort of like what's probably okay and what's probably not. And I'm kind of, yes, like I said, do everything very thorough, take your time, don't try to rush anything and then go too quickly back into activities, because I haven't been active for like so many years. But at the same time, I'm very impatient and I want to, get back to maybe living a hopefully somewhat decent, normal life-ish. So, I'm probably over talking it at this point, but yeah, 1 week you might be able to get out of the sling for very minor tasks, like just sitting. And then after 2, maybe 3, 4 weeks, then you could be fully out of the sling. But, it's probably not a bad idea to still wear it when you're sleeping, because that's kind of a area where you don't control as much once you're obviously like unconscious. But anyway, thanks for watching. Again, my name's Anand Patel, 23 years old, Latarjet procedure. And yeah, I just hope to update you guys and give you a little less anxiety like going into this thing. And hopefully, maybe, who knows, I'm trying to make sure I actually stick to it, but 3, 6, 9, 12 months from now, we'll see what the result is and see if this one works.